Good morning, Rog Taylor. I'm Mihiraa. Let's begin your warm-up session. How do you approach communicating with patients and their families?
In my approach to patient and family communication, I prioritize empathy, clarity, and active listening. I understand that effective communication is crucial for building trust and rapport. When interacting with patients and their families, I strive to create a comfortable environment where they feel heard and respected. I use clear and simple language to explain medical information, ensuring they understand their condition, treatment options, and any necessary instructions. Additionally, I encourage questions and feedback, fostering open dialogue to address concerns and alleviate anxieties.
Can you provide an example of a challenging patient interaction and how you handled it?
Certainly. In one instance, I encountered a patient who was reluctant to follow the prescribed treatment plan due to fear and misunderstanding. Instead of dismissing their concerns, I took the time to listen attentively and address each of their worries with patience and empathy. I provided additional information, clarified misconceptions, and discussed the potential benefits of the treatment. Through open communication and reassurance, I was able to build trust and ultimately collaborate with the patient to develop a plan that they felt comfortable with, resulting in improved compliance and outcomes.
How do you ensure effective communication with patients who have limited English proficiency or other communication barriers?
When communicating with patients who have limited English proficiency or other communication barriers, I employ various strategies to ensure effective understanding and engagement. Firstly, I utilize interpreters or language assistance services whenever necessary, to facilitate clear communication. Additionally, I rely on nonverbal communication such as gestures and visual aids to convey important information. I also encourage the use of family members or friends who can assist in translation if appropriate. By adapting my communication approach to the individual's needs, I strive to overcome language and cultural barriers, promoting patient-centered care.
How do you handle situations where patients or their families express dissatisfaction or concerns about their care?
When patients or their families express dissatisfaction or concerns about their care, I address the issue promptly and professionally, prioritizing resolution and patient satisfaction. I start by actively listening to their concerns without interruption, acknowledging their feelings, and empathizing with their perspective. I then investigate the matter thoroughly, seeking to understand the root cause of the issue. Once identified, I collaborate with the healthcare team to develop a solution that addresses the concerns and prevents similar occurrences in the future. Throughout the process, I maintain open communication with the patient and their family, providing regular updates and ensuring their involvement in decision-making.
How do you maintain patient confidentiality and privacy during interactions?
Patient confidentiality and privacy are paramount in healthcare, and I adhere to strict ethical and legal standards to safeguard this information. During patient interactions, I ensure that discussions take place in private areas away from public view or hearing. I refrain from discussing sensitive information in open spaces where others may overhear. Additionally, I handle patient records and information with the utmost care, only accessing and sharing data on a need-to-know basis and following established protocols for data security. By prioritizing patient confidentiality and privacy, I uphold trust and respect in the patient-provider relationship while complying with regulatory requirements.
You can now start the OET roleplay.
Well, Mihiraa, thank you for bringing Mia in today. I understand you're concerned about the rashes she's developed on her chest.
Yes, Nurse Taylor. We are worried. It might be measles because a few kids in our neighborhood had it recently.
I understand your worry, Mihiraa, but after examining Mia, it's evident that she's experiencing Roseola Infantum, not measles. Roseola Infantum is indeed a viral illness, and it typically manifests with a sudden onset of high fever, which can understandably cause concern for parents. Following the fever, a rash typically appears, adding to the distress. This condition is quite common among infants and toddlers, particularly between the ages of 6 months to 2 years. While it's natural to feel anxious, rest assured that we'll navigate through this together, ensuring Mia receives the care and support she needs to overcome this illness.
Oh, I haven't heard of that before. How is it different from measles?
I completely understand your concern, Mihiraa. Let me explain why I believe Mia has Roseola Infantum rather than measles. Measles typically presents with symptoms such as cough, runny nose, and red eyes, followed by the onset of fever, and only after a few days does the characteristic rash appear. On the other hand, Mia's symptoms align more closely with Roseola Infantum. In this condition, the fever tends to spike suddenly, reaching temperatures of 103 to 105 degrees Fahrenheit, without the initial respiratory symptoms seen in measles. The distinguishing factor is that the rash in Roseola Infantum appears after the fever subsides, usually around 3 to 5 days later. Now, let me describe the rash that Mia has. In Roseola Infantum, the rash typically manifests as pink or red small, flat, or raised spots. These spots tend to first appear on the trunk before spreading to the limbs and neck. While it can certainly be unsettling to see, it's important to remember that with proper care and attention, Mia will likely recover fully from this viral illness.
That sounds different from what I've heard about measles. But is Mia going to be okay?
Mihiraa, I understand that learning about Mia's diagnosis can be concerning, but I want to reassure you that Roseola Infantum is generally a mild and self-limiting viral illness. Most infants who contract Roseola Infantum recover without any complications. It's important to remember that Mia's body is equipped to fight off this virus, and with your loving care and attention, she will likely bounce back to her cheerful self in no time. Mihiraa, do you have any other concerns or questions?
Okay, nurse, that's reassuring. What can we do to help her feel better?
Mihiraa, let's talk about the management plan for Mia's comfort during her illness. To help alleviate her symptoms, we can use acetaminophen or ibuprofen to manage her fever. It's important to administer these medications according to the dosage instructions provided by your pediatrician. Additionally, ensuring Mia stays well hydrated is crucial, so offering her fluids like water, breast milk, or formula frequently is important to prevent dehydration. In terms of keeping Mia comfortable, dressing her in lightweight clothing can help regulate her body temperature and prevent overheating. Keeping the room cool by using a fan or adjusting the thermostat can also help ease any discomfort she may be experiencing. These simple measures can go a long way in ensuring Mia's comfort as she battles through this viral illness. If you have any questions or concerns about managing her symptoms, please don't hesitate to reach out.
Okay, that sounds manageable. Should we watch for anything specific?
Yes, Mihiraa, it's essential to monitor Mia's condition closely at home. If her fever persists for more than a week, if she becomes unusually irritable or lethargic, or if new symptoms develop, such as difficulty breathing or seizures, please seek medical attention promptly.
Understood. Thank you, Nurse Taylor, for explaining everything so clearly.
You're welcome, Mihiraa. It's important to keep an open line of communication. If you have any further questions or concerns, don't hesitate to reach out. We're here to support you and Mia every step of the way.